Hello, welcome to Sonography-radiology training channel. This series of videos is radiologic findings in fractures and dislocations of the shoulder. This is the first video in this video series about anterior shoulder dislocation. Anterior shoulder dislocation is by far the commonest type of dislocation and usually results from first abduction, external rotation, and extension. What is the epidemiology of this lesion? In general, anterior shoulder dislocations occur in a bimodal age distribution. The first and by far the more prevalent age group are young adult men who have sustained high energy injuries to the shoulder. The second group is older patients who have been injured with a much lower level of violence. In older patients, the dislocation usually proves to be an isolated event. Is there any predisposing factors for this dislocation? Yes, flattened shallow anterior or anterior-inferior glenoid bony contour may predispose to recurrent dislocations. What is the radiologic findings of this lesion? Anterior shoulder dislocations can be further divided according to where the humeral head comes to lie. The most common type is subcoracoid, subglenoid, subclavicular, and very rare intrathoracic. Now we will review a few teaching cases together. Case 1. 20-year-old man who fell off his longboard while going downhill at a speed about 20 miles per hour, landing on his shoulder and buttocks. The AP radiographs showed the humeral head is dislocated and projects in a subcoracoid location, and the glenoid fossa is empty. The Grashy view, which is a 45-degree oblique view that shows the glenoid articular surface in profile, shows that the inferior margin of the glenoid overlies the superlateral projection of the humeral articular surface. The Y view, which is a lateral view of the scapula that projects the scapular body in profile, the scapular spine, and the coracoid process providing the limbs of the Y, shows that the humeral head is located anterior and inferior to the glenoid process. The axillary lateral view shows the location of the humeral head is out of the glenoid fossa. We can see here the normal axillary lateral view, which humeral head is in the glenoid fossa, but here the glenoid fossa is empty. Also, we can see impaction of the anterior bony margin of the glenoid ring into the humeral head, causing an impaction fracture. Now, case 2, 18-year-old man in motor vehicle crash. The AP radiograph shows the humeral head has dislocated from the glenoid fossa into a subcoracoid position. The axillary lateral view shows the humeral head is anterior to the glenoid process and the glenoid is impacted into the head. Axial CT scan through the level of the coracoid shows a mildly displaced avulsion fracture of the tip of the coracoid process and empty glenoid fossa. CT at a slightly inferior level shows the anteriorly dislocated humeral head and the impaction of the anterior margin of the glenoid into the humeral head. This is a heel sulcus lesion, means the compression fracture of the humeral head, which occurs in more than 50% of anterior dislocations. This case was an example of anterior shoulder dislocation, coracoid fracture, and heel sulcus lesion. What is the teaching point of this case? Approximately 95% of shoulder dislocations occur anteriorly with the head in a subcoracoid position. External rotation and abduction is the common mechanism. Heel sulcus lesion, the compression fracture of the humeral head, occurs in more than 50% of anterior dislocations. Now, case 3, 60-year-old man in high-speed rollover motor vehicle crash. Initial trauma radiograph shows anterior dislocation of the glenohumeral joint. Greater tuberosity avulsion fracture at the insertion of the supraspinatus tendon is also present. These are coronal and axial CT of the right shoulder following close reduction of the dislocation. The greater tuberosity fracture involves the insertion of the supraspinatus tendon. There is a large complex impaction fracture of the humeral head also. What is the teaching point of this case? Persistent pain after healed greater tuberosity fracture may be a sign of rotator cuff tear or labral injury, which are associated with greater tuberosity fractures. Isolated greater tuberosity fractures can occur in the setting of anterior dislocation, impaction injury with the acromion or superior glenoid. Greater tuberosity fractures are seen in approximately 15% of anterior dislocations. Now, I suggest 2 others of my videos that are close to this video in terms of matter. Thank you for your attention.